Safe Supply is supposed to be part of a harm reduction program that helps addicts. Unfortunately, a good idea gone bad is what it looks like. Hi, I'm Brian Lilley, political columnist for the Toronto Sun, joined by Adam Zivo, who writes for both National Post and Toronto Sun. And your organization, Break the Needle, Adam, is working hard on exposing problems in drug policy in Canada, correct?
Yes. So Break the Needle is the media arm of the actual nonprofit, which is the Center for Responsible Drug Policy. So they're two different brands, but they're one legal entity.
Okay, so you've been doing great work even before starting your Center for Responsible Drug Policy. You've been doing great work at exposing problems. Um, were you always an activist against drug policy, or how did this start? Because it seems like you have probably come at this to me as someone who was just looking around and going, "Hey, they told us this would help. It doesn't look like it's helping."
Well, so there's two factors at play here. The first factor is that I come from a medical family. My mom was a pharmacist for over 30 years before she retired. And I grew up, staying in the back room of her family pharmacy, playing video games, being surrounded by pharmaceutical drugs, and hearing stories about how the healthcare industry could be quite dirty and corrupt at times. I'm not going to go into details of these stories, but from, listening to my mom, I was very well aware of the fact since I was young that sometimes drugs are overprescribed by unscrupulous doctors, and sometimes pharmacists who want to make a buck too will fill these prescriptions. So when I heard that Safer Supply was likely being abused, it wasn't a surprise to me. This was very consistent with all the background information that I had in my head. And I began to realize that there was this very big scandal about the fact that Safer Supply was being resold on the black market, almost all of it really, and that no one was talking about it. And I spent months investigating in early 2023, and I put together this 10,000 word expose for the National Post. And I was optimistic at that time. I thought that this expose would change things, that it would show people that there was a real problem and that people were suffering because of the failures of this program. Unfortunately, my optimism was misguided. The systems in place that support Safer Supply turned out to be more unscrupulous than I anticipated, and they basically continue to gaslight the public about diversion.
Well, so shortly after your piece came out, um, I believe it was shortly after your piece came out, Global News did a TV piece showing where they had people go and buy the pills for a buck a pop in Vancouver and said, see, yeah, this is happening. And I remember conservative leader Pierre Poilievre standing up in the House of Commons asking about this and being told that he was lying and trying to scare people by then Health Minister Carolyn Bennett, who, she's now retired and the seat she held was just lost in a by-election. So the government has denied this from the beginning. Now, at best, I'd say they're downplaying it, but the activists are still saying, nope, it doesn't happen at all, right?
To a certain extent. So I just want to clarify that that incident with Global News actually revealed some of the misleading narratives used by Safer Supply advocates, including their allies in the government. So the
Mm-hmm.
Ministry of Mental Health and Addictions responded to Global News' investigation by saying that it is impossible to tell whether hydromorphone, which is the heroin strength opioid distributed by Safer Supply, whether these pills, if they're purchased on the streets, uh, come from Safer Supply, even if the drug user, even if the drug dealer is telling the customer that is coming from Safer Supply. So they essentially told the public that even though the drug dealer said this came from Safer Supply, it is impossible for us to know for sure. Now,
And look, there have been incidents photographed of people selling it still in the prescription bottle with a name on it, and,
yeah,
and it still is. Oh no, well you can't say for sure. All right, so you know,
well, that's the thing. Their comment is not only at its face value inaccurate, but it's inconsistent with what they otherwise say because they always stress how they are closely monitoring diversion, which assumes that diversion is possible to measure. And then when other people come up with evidence of diversion, they say, well, actually, diversion is impossible to really, measure because we can't tell where these drugs come from. So which one is it? Can we measure diversion or not? the answer for them seems to depend on what is most convenient and what looks best on safer supply, in depending on which context.
One of the big advocates for safer supply, may have been one of the first in the country, definitely the first in Ontario, is Dr. Andrea Serrata, runs an organization in London, Ontario. And she's been outspoken when you've written about safer supply, when I've written about safer supply, when local councillors in London have raised the issue of safer supply. She has at times tried to bully people into silence, saying that this isn't true. Don't spread lies. She went before a parliamentary committee and said that diversion of safer supply definitely wasn't happening. But I want to play a clip that you, well, I won't ask you how you got access to this, but
Mhm.
this is a meeting of, was it Moms Against Harm? Is that the group?
Mom, stop the harm.
Mom Stop the
Yeah.
Harm. And they are safer supply advocates. And here's Dr. Serrata talking about how, yeah, diversion happens.
I'm not going to stand up here and say that some kids, some adolescents are not accessing diverted safe supply and using diverted safe supply. Kids experiment with everything, and we need to be honest to ourselves that kids probably experiment with diverted safer supply as well.
So, Adam, after all the times that you had heard from Dr. Serrata and others that, oh, no, stop spreading lies, this is misinformation, that never happens. What was your reaction when you saw that clip from their internal annual general meeting?
I think it was shocking, but at the same time, not altogether unsurprising, given how contradictory safer supply advocates have been in the past when it comes to diversion. Now, what I want to stress is that in the past, Andrea Sarita has emphasized that it is basically not possible that kids are accessing safer supply. When my 10,000 word investigation came out last year, she told the London Free Press that no one was able to come up with any stories that youth were accessing diverted safer supply. She referred to this concern as a boogeyman tale. And then in Parliament, when she said that there was no evidence of safer supply, she said that very definitively. So a Conservative MP asked her, "Is it possible? Is it possible that kids are accessing diverted safer supply?" Her response is that there was no evidence that kids were accessing diverted safer supply. When MP Layla Goodridge expressed concerns about kids accessing diverted safer supply, she said that no, kids are not buying safer supply. Right. So the messaging there is quite definitive. It's kids
Mhm.
are not accessing these drugs. And now we see in this clip where she is telling an insider audience of harm reduction activists that we have to be honest with ourselves, that kids experiment with everything, and that they are probably accessing diverted safer supply. So that message is very much contradicts what she's told the public. And it seemed as if she had an expectation of privacy because elsewhere in the meeting, she talked about how she supports the distribution of safe meth and cocaine and how if doctors could prescribe these drugs that they would get, that they would help combat the drug crisis. And when she mentioned that, she said she hoped that there was no mole, in the conversation. And she referenced how there was a mole in a previous Zoom conversation because 2 days before this meeting, the National Post had published a story of mine where I had gotten secret recordings of harm reduction activists in Vancouver plotting to disrupt their opponents. So
And
when
in
she,
that instance, just describe how they disrupted their opponents, because there's, my understanding, a meeting of doctors. Some were going to speak and say things that these activists didn't like, and their plan was just shut them down. They want to shut down any opposition to their point of view.
Yeah, so this conference there was a conference known as the Prosper Conference, and it was put together by a number of well-respected drug policy advocates and doctors. So the two main figures here were was Kevin Sabet. So he was a senior drug policy advisor for the White House under both the Bush administration and the Obama administration. So he was one of those rare bipartisan figures. And then
Mhm.
the other expert here was Dr. Keith Humphreys, who is a Stanford professor who has been one of the leading figures in guiding drug policy in both the United States and the UK. So these are not some random crackpots. They're very well respected. And then they were accompanied by a number of addiction doctors, all of whom wanted to advocate for a recovery-oriented approach to addiction, where harm reduction is recognized as one aspect of our response, but where the more radical interventions are abandoned because they're not effective, and where the focus is on, once again, getting people sober rather than enabling their addiction. And so the Vancouver Area Network of Drug Users, VANDU, thought that this was, this was intolerable. So they put together a Zoom meeting, and about 20 harm reduction activists, mostly in BC, but some in Ontario as well, plotted to disrupt this. They wanted to send an activist to secretly record attendees, which seems like a form of intimidation. They explored the possibility of dyeing a fountain red, of driving a car.
They
Right?
were going to fill fire extinguishers with red dye and spray it everywhere.
That is commonly misunderstood. So Zoe Dodd, who's the Toronto-based activist who said that, joked about that, but that was a joke.
Oh, okay.
But yeah,
It
but
still
what
sounds bad.
it sounds bad, but so the reason the reason why I brought that up from Zoe is that her quote then segued into her uh bragging about how at a previous conference back in autumn, she and fellow harm reduction activists had intimidated and scared doctors there. And she said they were so scared, they didn't want to, they couldn't do anything, they couldn't kick us out. And her the way that she took such pleasure in intimidating doctors, and the way that she bragged about scaring them into silence and then filming them in a way that made them feel uncomfortable, I thought was very revealing.
You and I have both interviewed another doctor out of London, Dr. Sharon Koivu, and very brave in speaking out on some of this. She has been at times a harm reduction advocate, and in a different way. But one of the things that has stuck with me since we had her on the Full Comment podcast last year, she said there are 4 pillars of drug policy. There's prevention, enforcement, harm reduction, and recovery. And she said we've essentially abandoned 3 pillars and put everything into harm reduction. And it's no longer harm reduction; it's what you just described it as: aiding and abetting people's addictions. How do we get out of this with sensible policy? Because the Ford government has put a pause on expanding safe consumption sites, but the federal government is going forward with more safer supply sites. And I remember looking into the South Riverdale Community Health Center. That's the one here in Toronto where the shooting happened last year. Shooting happened because of drug dealing going on next to a safe supply site, and an innocent woman walking to get lunch for her and her family gets shot and dies. The advocates just said, well, there's no proof that this is connected. Just ignore everything your eyes can see. There's no proof that this is connected. And then it turns out that employees are involved and everything. But as soon as somebody says, we want to move away from this, we want a recovery-based approach, the activists come out and they seem to have a control on much of the conversation, because the idea that recovery is as good as just keeping people addled on drugs has somehow won the narrative.
Well, if we want to change this, first of all, we need a change in political leadership at the federal level, because liberals are not going to do anything about this because they genuinely believe that this is the right way to go. And also, they are politically invested in this route. For them to admit that safer supply doesn't work would be them admitting that they pumped our communities with opioids and harmed children, and that's politically toxic, right? Mm-hmm. At the provincial level, it depends on which government you're talking about. We need to see a change in government in BC. And in Ontario, we need to see more leadership from the premier, because we have to remember that most of these interventions fall under provincial jurisdiction. So for example, with Safer Supply, it mostly is actually a provincial matter. So Safer Supply is basically just prescribing hydromorphone, which is a pharmaceutical opioid, off-label for the use of addiction, right? And what the federal government is doing is that it is funding programs where that incentivize doctors to prescribe this way, and to produce research which misleads the public into thinking that this is effective, essentially bribing doctors or incentivizing doctors to provide safer supply. However, safer supply is permitted because our provincial laws or regulations allow it to be permitted. Mm-hmm. And In Alberta, they said no. And the provincial government essentially outlawed the off-label use of hydromorphone for safer supply reasons. Ontario could do that exact same thing. The premier could end safer supply unilaterally if he wanted to, but he's paying a lot of lip service without actually doing anything.
Yeah,
And
well, I know that he faces a lot of pushback, as every premier does, from the health bureaucrats who are fully invested in this. They believe in it. It's like religion. But you're right. Leadership would be saying, no, we're just going to stop this. We won't allow it. Um, I know the feds they started these programs, but you're right. The province could step in and say, no, it's done.
yeah, and in fact, the province could actually publicly publish some data that would help us understand the extent of the damage caused by safer supply. So, in a recent letter that Premier Ford sent to the federal government, he said, "We don't know how much hydromorphone is being dumped into our communities through safer supply," which I thought was quite questionable because this hydromorphone is being dispensed through OHIP, right? So our the provincial government should have an understanding of how much hydromorphone is being dispensed in the province and where it's being dispensed. I mean, we can't be fully certain whether an individual dispensation is related to safer supply or not, but we can approximate using this data. So I am shocked that the province, if it actually opposes safer supply, hasn't pulled up this data and published it yet to illustrate the amount of opioids flooding into our communities.
Well, it is an uphill battle to push back against what has become religion, as I say, for some, and religion for the people who are the permanent government, the ones who stick around even if we change the elected officials. So it's a big fight, and you've been a big part of it. Thanks for the time, Adam.
Thanks for having me.
Let me know what you think. Drop a comment down below. Share this on social media, and don't forget to subscribe to our channel.